All right, I think we ended here talking about the layers of the skin and keratinization. So keep in mind that only certain types of skin, we have two main types of skin, thick and thin skin. With thick skin right here, it has all 5 layers, including the stratum lucidum. Now those are areas where you have the most friction, the most pressure. So if you're walking around barefooted, you're gonna have a lot of both, right? So it makes sense you want even more protection. That's why we have that 5th layer called the stratum lucidum layer. It also is the reasons why we have fingerprints and footprints. If you would put your forearm on the ground or on even like on a piece of charcoal or something, right? And then you put it down somewhere else, you will not have any print from placement of your forearm. But if you put your fingers down, you will have very noticeable prints, right? The fingerprints. And if you've ever had babies, right? When you have a baby, then the baby finally gets home, they usually give you a nice little, like a nice plaque to go with it, or a nice something to put into a frame, and they have the baby's footprints, the first footprints that you have as part of the frame as well. So footprints, fingerprints, they're found where they are found is because they have that 5th layer. It's thick skin, and we're going to see in those areas we have a little bit more movement of the dermis into the dermis. So you have a little bit more of these dermal papilla that undulates back and forth right here. It looks like egg crates right here. So if you have like a memory foam insert on your bed or something, they usually have this kind of egg crate appearance to it. Well, these finger-like projections are called a dermal papilla, and we see those primarily in the hands as well as the bottom of your feet. The weird thing is this: you think because you have more layers, you'd have decreased sensitivity. In reality, it's the opposite. Because we're making contact with the environment, with our hands, with our feet, we have actual increased sensitivity in our hands and the feet, even though the skin is thicker. So you have increased sensitivity to any stimulus, pain, pressure, touch. All of those type of sensations are more sensitive than in thin skin. It kind of makes sense why, right? Because that's how we manipulate the environment. You're grabbing things with your fingers, not your forearm. Because you're grabbing it with your fingers, you need more sensitivity there. Thin skin, 4 layers of epithelial strata, less sensitive, more flexible though. This is the area, this is the most common, the thin skin. And because it's less sensitive, we can do more things to it. What do I mean? You guys have probably seen like some of the, if your parents have diabetes, they will have to check their blood sugar a lot. My dad has it, so he has to always check his blood sugar. As you check your blood sugar, you have to prick your finger. Now, if you've done that for many, many days, for many, many years of your life, it starts developing calluses, and it becomes even more painful to use that finger. Well, some of the newer ones, you can actually use your forearm, right? You can prick the forearm, and then you can get the blood there and use that blood to activate your glucosamine. Well, the good news is, number one, because you're no longer using your finger, you're no longer causing pain in the more sensitive type of skin. In the forearm, you have thin skin, and it's less sensitive, right? This is also the reason why sometimes you get a scrape or a cut in your arm, and you don't even know how you got it. You just look at it, you're like, oh, I got a scrape in my arm, right? Or you get a cut there. And then you sometimes notice when it's bleeding, and that's it. Why? Well, you have less sensitivity there, so you didn't even notice it when you get a cut. But most of us have gotten something even as small as a paper cut. When you get a paper cut on your finger, you know right away you get that paper cut, right? It feels like a much deeper cut. And then when you look at it, it's just a small little cut. So why does it feel so much deeper? And why does it feel, it does feel more painful. Why? Because in your fingers, you have thick skin, and it's more sensitive. In your forearm, you have thin skin. And even when you do get a cut, because it's less sensitive, you might not even notice you got that cut. This is also the area, the type of skin where hair growth occurs. Calluses. If you guys have started working out before, you're gonna have a lot of calluses. right? Calluses are increase in the number of layers found in the stratum corneum. This should make sense. So let's say I haven't worked out in a while and I start working out. As I start working out, let's say I start bench pressing, and now all that weight of the bar and, right, the weights on the side, well, that's pretty heavy, right? It's about maybe 200 pounds, right? The more you put weight on there, the more stress you put onto the skin on the dorsum of your hand right here, in the palm of your hand. The more stress you put on it, the more these cells start to die off earlier. And as they start to die off earlier, now this layer becomes thicker and thicker, right? The stratum corneum layer is a layer of real dead tissue. As you start having more and more friction and pressure, you'll have more and more layers of the stratum corneum, and now that is a callus. And it's due to that increased pressure and increased friction, causing premature deaths of these cells as they migrate upwards here. Now you have more layers, and usually you have a little bit more protection. Now, what happens when you stop working out? When you stop working out, you no longer have that pressure or the friction of your hand rubbing on the bar. Well, without that, these cells don't die as early as they did before, right? They get a little bit further away before they die. And what happens? Your stratum corneum layer starts to thin out, and your calluses start to disappear, right? So I used to, kind of worry about it when I was younger and working out. Now, to prevent any of these calluses, it's just easier to wear gloves, right? So wearing gloves kind of defeats all of that. Because if you've ever ripped a callus before when you're working out, it is not fun, right? So just be careful. Calluses do heal. They are thickening that should be protective, but eventually you get sick of the calluses and you start picking at it, right? So without the actual stimulus of working out, pressure, as well as that friction, the callus disappears. Skin colorization is going to be determined by 3 factors. Pigments, determined by genetics and geography, blood circulating through the skin, and then thickness of the stratum corneum layer. Now we're going to talk primarily about the melanization right here, right? And we kind of mentioned it before, how cool it should be that we all have different colors and we all have different activation of melanin. And it's kind of cool when you think about what happens here. When we have increased ultraviolet radiation, we need to get protection from the sun. How does our body protect our own self from the sun? It makes us darker in color. So what happens? You have ultraviolet radiation, it activates your melanocytes. The melanocytes start to produce these droplets right here, these vesicles of melanin. The melanin then gets picked up by all of the cells surrounding it. So all the keratinocytes right here, they start also filling with melanin. As they start filling with melanin, they start to darken. Each cell does. As each cell starts to darken, now you've darkened that area. Now what happens if I wear my watch and I go out in the sun during the summer? When I go in the sun during the summer, I get really dark, right? I get dark, people think I'm like, right, Samoan and, right, like real like Pacific Islander dark, right? And what happens is when I wear my watch, well, the area where you have your watch, obviously the ultraviolet radiation can't hit that area. So that area has blocked the ultraviolet radiation. And what happens then? You darken in the areas that do have that contact with ultraviolet radiation. The areas that don't, you don't activate the melanocytes there. So the skin in that area is lighter. And when you take off your watch and it has that same pattern as your watch does, right, it's because you have actually blocked the sun from getting through there. Same thing when you're wearing a t-shirt and you have, and you're out in the sun jogging or whatever, and you're wearing a t-shirt and you have like a farmer's tan all day. Well, it's because the actual shirt blocks that light from getting through. Only the region where you have direct light rays hitting it, only that region will cause more melanocyte activation. And only those regions will release more melanin, so then it gets picked up by those cells. Now, what happens after a few months, right? I've been out in the sun all day. I used to coach football when I was younger, right? And then you are coaching football, you're in the sun all day during the summer. And then during the winter, you start getting lighter and lighter skinned. Why? Well, because of what happens with the process of desquamation. In the summer, I have all of those melanocytes releasing all that melanin. My skin gets really dark. But what happens during the course of time? Right? All that darker skin cells, those darker keratinocytes, they start to migrate upwards. And then with time, you lose all the darker, right, cells. And then you hit fall. Fall, you no longer have as much sun. And if you did, you're not wearing just a t-shirt anymore because it's getting colder. And now you no longer activate to produce more melanin. And now then the cells start to become lighter in color because they never got that activation, because now it has fall. It is now, the autumn season. So this is the reason why we tan. It's also the reason why we lose our tan with time. We lose our tan because as those melanocytes release the melanin, those cells that pick it up, they darken, but they migrate upwards too. As they migrate up, right, if you keep being exposed to the sun, you keep producing darker colored cells that migrate up. But once you hit that autumn part and you're no longer exposing your skin to sunlight, well, your old cells that were darker started moving up, and now the new cells no longer gets that same amount of melanin because it's now fall. And because of that, your skin starts to lighten in color again during the winter. Again, it's all kind of pretty cool. Albinism. Now, albinism is an actual inherited disorder. I won't even call it disease, right? Deficiency or absence of pigment. Now, there is a actual amino acid we use to make melanin. That amino acid is called tyrosine. In albinism, they're missing one of the proteins that forms melanin from tyrosine. Because of that, they have no color at all. People that have true albinism have red color eyes, right? Their hair is very light in color. Their skin is pale white in color. Now, what happens when you have that kind of absence of pigment? Well, you are more prone to sunburns, more prone to even weird things like burning the retina and burning the iris. The reason why their eyes look red is because without color in the iris, right? An absence of color. What happens is you see the blood vessels deep in the iris, and the blood vessels are red. And that is the colorization we get and what we see in people that have true albinism. Greater probability to burns and skin cancers. And then we have people that have vitiligo, right? Vitiligo is a condition, it's an autoimmune disease, and this is a true disease, where your melanocytes are targeted for some reason. With vitiligo, you're gonna see, with vitiligo, usually it starts off in the hands. We say you have a glove appearance of the hands, and then it can spread everywhere. Everybody can get it. Anyone can get it, whether you are light skinned, whether you're dark skinned. Obviously, if you're darker skinned, it's going to be very pronounced, all right? Now, there's some beautiful models that kind of show, I think she was in one of the shows, right? America's Next Model or something, right? And she, didn't cover herself up anymore, right? And she came out just like this, which is perfect. Now, eventually, all of those melanocytes will be attacked, and you're going to lose all of that colorization. Now, the only bad news about this, and it's really bad, is that if you're not careful, you can burn just like somebody with albinism. So I had a friend that had this, right, vitiligo on his hands, and he forgot to put sunscreen on the hands when we went out to coach. All it took was 10 minutes being out there, and his hand was burning, right? Now, with them, it goes a step further. If he stayed out for another hour or so, he will see blistering. It is that kind of sensitivity. It's not like a typical sunburn that we'd imagine we get sunburns. No, you will get blistering of the skin. Most of us will never get that kind of sunburn, right? But people with vitiligo, people with albinism, they can get that terrible type of sunburn. In terms of vitiligo, again, true autoimmune disease. So the only way to really kind of treat it is to give people large doses of steroids, like prednisone, not the anabolic type, right? And some kind of mild chemotherapeutics that decreases their white blood cell count. That's it. So we're talking about some pretty strong things we have to give them, right? Now, the next one we're going to talk about in terms of skin colorization is going to be a combination of jaundice and keratinization, right? It gets confused. Jaundice, we can see, is a yellowing of the integument and the sclera. So the white of your eyes becomes yellow. So right away, I don't even look at the skin color. All I look is the actual white of the eyes. If people have jaundice, their sclera should be very yellow. I have a friend that was a really bad alcoholic, right? And he was drinking, and he would drink, and he would drink all day, all night. The other day I saw him, actually about 3 weeks ago, I saw him walking out of Sendix. Right away when I saw him, he looked bright yellow, right? I looked at his eyes, it looked bright, bright yellow. I have never seen somebody this jaundiced before. And as I was looking at him, I looked at him and I knew he was gonna die, like really quick. Because he was so jaundiced, it's a sign that your liver has started to really, really fail. And he was in acute liver failure. And I haven't seen him in like 5 years. I did not know. So when I saw him walking out, I was like, oh my God, it looks terrible. I didn't even go up to see him and talk to him because I was just kind of like, oh, what would I say, right? Like, we look great. Well, he was so jaundiced that 3 weeks later, I got a message that he passed away, right? It was that fast. He was in acute liver failure and he was drinking all the way to the end, right? And we're going to talk about why the liver failure causes this type of coloration. One color that can get confused with jaundice is keratinization. Yellowish orange pigment from vegetables like sweet potatoes and carrots. Those are two most common causes. And usually who are most likely affected? Kids. So when we see keratinization, it looks like jaundice, but it's not. Why do we know it's not jaundice? It's because it does not affect the sclera. It only affects the skin. So when we see people that have keratinization, right, usually is from overfeeding. And they kind of look like they have like a tan, right? They look very bright yellow, kind of like some certain president, right? And they look very bright yellow, and it's usually not harmful at all. And it's actually, I wouldn't say it's a good sign that they're getting a lot, but it's not a bad sign, right? With this kind of keratin color, it's usually caused by mom and dad really excited about baby now eating solid food. So once baby starts eating solid food, mom and dad wants a baby to eat a lot, right? So baby's not gonna eat a lot of carrots, or even better yet, they're not gonna eat a lot of broccoli and cauliflower, right? No matter how much you might think they like it, they're not gonna like it. So instead, they like something that's sweet. Sweet potatoes, carrots, squash, all of those are very sweet. The problem is they all have a lot of beta carotene. And if you keep feeding them carrots one meal, and then the next meal you give them sweet potatoes, the next meal you give them squash, all with a lot of carotene, eventually after the course of a few weeks, they have a lot of carotene buildup. And what happens? They look very orangey yellow. Right? Now, how can we tell this is not jaundice? By looking at the white of their eyes. None of this colorization from carotene affect the white of the eyes. And what happens is, it's not a bad sign. We just tell mom and dad to just back off a little bit of the squash, of the sweet potatoes, right? You don't have to completely remove it. Just don't eat it 3 meals a day, right? So that is something that does happen. It's not a sign of any damage. It's not a sign of any disease. In terms of other skin color, people can get pretty bright red sometimes. If you're pretty fair skin, right, you can get erythema that becomes very noticeable, right? Erythema is a reddish hue, and it can occur during blushing and anger, or it can occur when you have any type of increased body temperature. Fevers. Some kids, their cheeks get super red when they have a fever, right? It's a sign of that fever. Any kind of increased body temperature will cause this erythema. Now, sometimes you get a cut, or you get a cut and it becomes really big, and it becomes infected, and it becomes really red and angry. We say that that area is erythematous, right? Erythema, E-R-Y-T-H, usually means red. That root is Latin for red. Cyanosis is a blue coloration that we see when there's decrease in blood oxygen, whether it's due to lung disease or with decreased oxygen in the atmosphere. So if you have lung disease, you're not affecting the oxygen content in the environment, but you can't get that oxygen into your system. So even though there's a lot of oxygen in our environment, people with lung disease, right, they have a harder time getting it into the lungs. They have a harder time getting that oxygen when it's in the lungs into the bloodstream. So that can cause that cyanosis. More commonly, we see it with hypothermia, right? You go outside and you forgot to wear your jacket, or you're like my daughter and doesn't like wearing jackets. And after you've been out for a couple of minutes, your lips turn blue, right? After a couple more minutes, your fingers start to tingle, and they start to hopefully not turn blue, but they might start losing their red color. And then they will eventually turn blue if you don't get inside or warm your fingers. All right, so hypothermia causes cyanosis due to vasoconstricting the blood vessels next to your skin. When that happens, you don't have as much blood flow. That area starts to look bluish in color. Right? Now, jaundice, we kind of started talking about before. In terms of jaundice, the most common cause of jaundice in America is alcoholism. Right? Now, why does liver cause jaundice? Liver failure cause jaundice. And the reason why is because of how our body processes the formation of red blood cells. So when we start looking at jaundice, and I do want you to know this because you will see jaundice every now and then, right? You'll see it in kids, and we'll talk about why in kids we see it more, especially in babies. Now keep in mind, neonates, babies, right? Have they ever needed to have a functional liver? Not really. Mom gets rid of all the toxins. Mom gets and receives all the nutrients and gives it to the baby. So the baby's never had to have a functional liver. Even a full-term baby has never had to have a functional liver. So sometimes even full-term babies can be jaundiced when they're first born. Let's talk about why. Now, jaundice is caused by the fact that you have, and your body is going to make, in your bone marrow, you have erythropoiesis, where you're making 2 million red blood cells per second. If you're making 2 million red blood cells per second, you need to get rid of 2 million red blood cells per second. Right? You need to make, and you need to get rid of equal amount. If not, you're going to have a buildup of red blood cells. The more buildup of red blood cells, the more likely you're going to have some kind of clotting disorder disease. Right? So you need to get rid of an equal number. Where do we get rid of 2 million red blood cells per second? The spleen. The spleen recycles 2 million red blood cells a second. In the process, the proteins, the hemoglobin, the globin contains amino acids. Right? The amino acids from the globin chains are going to be recycled and reused. The iron. Yep, the iron that we need to have, that iron is very, 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 very important. We recycle that as well. Right? Now, as part of our hemoglobin, we have globin and heme. Heme is a complex structure of carbons and nitrogens. The sole purpose is to stabilize iron in the middle so that the iron can bind to oxygen. It is this iron that allows us to bind to oxygen. Heme stabilizes that interaction. So that heme is the part that we have an issue with. From heme, we make bilirubin. Right? That bilirubin then goes to your hepatic portal vein, goes to the liver. The liver turns that bilirubin into bile salts. Bile is what allows us to absorb fats. Fats, easy to absorb, we just make sure it gets broken down. Right? Bile kind of coats the fat, so then once we break it down, they don't reform again. So bile allows us to absorb fats, which is important. But it's formed by the liver from bilirubin. So if you're an infant and your liver has never been functional, all right, and actually in utero, the liver's, the actual pathway of blood flow, you actually detour blood. We say you have a shunt in the liver. So then we detour it away from the liver. We're going to see that even in the heart. There's slight changes in a newborn baby versus a baby that is in utero. Right? There are some massive changes. One of the changes is in utero, blood doesn't even go to the liver. Right? It's only when we start to, once the baby's born, do we bring a lot of blood to the liver. But what happens? In utero, baby's making 2 million red blood cells. Baby in the spleen is recycling everything. And then in utero, mom's taking this heme and getting rid of it, right? So when baby first comes out, they shouldn't look yellow. It should happen after they're born, all right? Why? Because after they're born, the liver has to become mature then, right? The liver will take the bilirubin and turn it to bile. But what happens if the liver is not mature? If the liver is not mature, you still have this. You're still going to make 2 million red blood cells a second. You're still going to recycle 2 million red blood cells a second. You're still going to produce a lot of bilirubin. But now the liver can't turn into bile salts. So then the bilirubin starts to build up and starts to build up. As you start to build up, then you have the jaundice that we see. Nowadays, we were very aggressive with it because if the bilirubin levels get too high, you will have permanent mental deficits. So now they give you billy lights and billy blankets. In the old days, especially if you live in the South, all right, in the West, where there's a little bit more sun, they'll tell you to go outside, all right, maybe have the baby be somewhat naked except for the diaper, expose the baby to sunlight, right? That exposure to sunlight breaks down the bilirubin that are next to the skin. So then you can decrease the amount. Nowadays, we just give them billy lights and billy blankets. Now, the billy lights and the billy blankets, the main purpose is to make sure the levels are not so high that it causes mental retardation. But does it cure anything? No. The only thing that cures it is when the liver itself becomes active. When the liver becomes active, any spare bilirubin gets turned into bile. Any excess gets turned into bile again. So then you don't have a buildup anymore. And it's the baby's own liver that starts to deal with that excess of bilirubin, right? Not the billy lights, not the billy blankets. Now, how about adults that are jaundice? Do we give them billy lights or billy blankets? Of course not, right? The reason why is their liver should be mature at that point. It's just failing. And there's no amount of Billy Lights or Billy Blankets that will decrease the bilirubin enough to help out. And for them, the increase in bilirubin is a sign of liver failure. The only thing that can help them at that point is number one, stop drinking. Number two, maybe a liver transplant, but most places don't put alcoholics, right, high on their liver transplant list, especially if you have kids that have like congenital defects in the liver, right? So liver transplants are usually saved for people that are healthy otherwise and that have not drinking their liver away.